My name is Myra and I'm going to conduct my neuro and my musculoskeletal assessment. Can you tell me your first and last name and your date of birth?
Rosa Atchison, May 19th, 1954.
Can you tell me where you are?
In Lithonia, Georgia.
What year is it?
2020.
So she's alert and oriented times 4. All right. Can you smell this for me? What does it smell like?
Chocolate.
So cranial nerve number 1 olfactory is intact. All right. Can you cover one eye for me? All right. Let me know when you see my fingers.
All right.
Okay. Next eye. Let me know when you see my fingers.
All right.
Okay. All right. So now can you follow my finger with your eyes? Checking for ocular movements. Okay. So good ocular movements and accommodation is noted. Okay. So pupils are +2. They're both equal and reactive to light and they accommodate. So perla is noted in the right and the left eye. Accommodation is also noted, and I've also noted consensual and direct light reflex as well in both eyes. So that makes cranial nerve 2 optic is intact, cranial nerve 3 ocular motor is intact, cranial nerve 4 trochlear is intact, and cranial nerve 6 abducens is also intact. Alright, so now we're going to test cranial nerve 5, trigeminal nerve. So I'm going to assess for TMJ. Alright, can you clench down on your teeth? Can you open your mouth? Okay, close your mouth. So no clicks, TMJ is intact. Close your eyes for me. I'm going to feel on your face. Let me know where I touch you at.
Forehead.
Yep.
Nose.
Yes.
My lip.
Yep. Okay, you can open your eyes. So cranial nerve 5, trigeminal nerve is intact. Can you smile for me? Can you frown? Can you raise your eyebrows? Okay. So cranial nerve number 7, facial nerve is also intact. Cranial nerve 8, acoustic is intact as well, her hearing as well. Cranial nerve 9 is your glossopharyngeal. Can you open your mouth for me? Okay, I'm gonna make you gag. Okay. Can you stick your tongue out? Open your mouth. Okay, say ah.
Ah.
Okay. So uvula rises on phonation, voice is clear. So that makes cranial nerve 9 glossopharyngeal as well as cranial nerve 10 vagus nerves are all intact. All right. Can you raise your shoulders for me? Okay, put your shoulders down. Can you raise them again against my hand? Okay, good. So good strength, shoulders are equal. Can you turn your head to the right? Press against my hand. Okay. Can you turn to the left? Press against my hand. Can you put your ear to your shoulder? Put your other ear to your shoulder. Can you turn your head right and left? All right. So cranial nerve 11 spinal accessory is also intact, and the strength and range of motion in the head, the neck, and the shoulders are full range of motion +5 against gravity and resistance. Then we have cranial nerve 12, which is hypoglossal. Can you say light, tight, dynamite?
Light, tight, dynamite.
Okay, so cranial nerve 12 is also intact. All right, so now I'm going to assess for DTRs. All right, so assessing my biceps. Okay, assessing my other biceps DTR. So far +2. All right, so now I'm going to assess. Just hold your arm freely. Okay, now I'm going to assess for my triceps. Okay, triceps DTR is a +2. Okay, triceps DTR, that's +2 over there as well. All right, so now I'm going to assess popliteal. Make sure you can see this. All right, assessing popliteal. Keep your leg flat. Okay, patellar. Patellar is +2 DTRs. I'm going to assess my Achilles by holding her foot, and I'm going to tap Achilles. Okay. Okay, so Achilles is a DTRs are all +2. So now I'm going to assess planar flexion. So good planar flexion is noted in the right foot. There's no Babinski. Okay, good planar flexion is also noted in the left foot. There's no Babinski. Can you do your heel to your shin like this?
Do.
On both sides. Okay, so good coordination, heel to shin test is good in both legs. All right, can you close your eyes for me again? I want you to touch your nose with each of your fingers. Okay, touch your nose with each of your fingers and close your eyes. Each of your fingers, one finger per note, like this.
Okay.
Next hand. Okay, keep your eyes closed. I'm gonna draw a number on your hand and you repeat that number.
6.
Yes, that's correct. So Graphisia test was good. I did draw 6. She also did good with the finger to nose test. All right, you can open your eyes back. All right. So now I've tested for DTRs. I'm going to test for your rhythmic movement. So I want you to pat your thighs like this. Okay. Now I want you to flip your hands back and forth. Okay. Now do it faster. Okay. You can stop. All right. So good rhythmic coordination with rhythmic movements is noted. All right, so now I am going to have you stand up for me. All right, I'm gonna have you stand up. We're gonna do some walking. All right, so you can just walk straight and forward like that. So first just stand. So I'm noting the spine is midline in between the scapula. There's no scoliosis. Can you bend over and touch your toes? Okay, so there's a C curvature in the spine. I'm gonna touch your spine, okay? Touching the spine, there's no crepitus, spine is midline. All right, you can stand up straight. Can you close your eyes for me? Doing my Rumberg test. Okay, you can open your eyes. So no swaying is noted with the Rumberg test. All right, so now I'm gonna have you walk straight, just walk normal. All right, so recognizing gait. Gait is steady. Stay right there. Gait is steady, it's easy. All right, so now when you walk back, I want you to walk heel to toe like this, in a straight line, like you're doing a sobriety test. All right, so testing for tandem walk. Okay, good, stop right there. All right, so tandem walk is good, good coordination, steady movement, it's easy. Gait is steady so far. Can you raise up one knee? Okay, you can put that down, raise up the other knee. Okay, can you hop with the knee? Okay, good, stop. You can stand straight. All right, so still good coordination noted, and there's good flexion and extension of the knee as well. All right, so now I'm going to, you're gonna feel me touch you. Tell me where I touch you at, okay? Sorry, I initiated pain, sorry, so pain is there. I touched her thigh, she know the position. All right, and then let me know when you feel the vibration on your toe.
All right.
Okay, so vibration is felt as well with the tuning fork. All right, so now assessing for musculoskeletal. So shoulders are even. I don't see any deformities in her hip joints. I'm gonna raise your dress a little bit. No deformities in her knees. No obvious deformities in her ankles. No dislocations or subluxations. All right, so now I'm going to touch, okay? So palpating the shoulder joints. No crepitus, no tenderness, no redness. Palpating elbows. No crepitus, no tenderness, no redness. Palpating the wrists. No crepitus. All joints are in place. And the fingers, joints are in place, no crepitus, no tenderness, no warmth or swelling as well. All right, now you're gonna feel me touch your legs. We're just gonna palpate. I'm gonna palpate your hips too. Okay. Hip joints are in place, no swelling, no tenderness, no crepitus. Behind the knee, on the patella, Feeling the ankles. You gotta take your shoes off. Take your shoes off. So far, no crepitus in any of the joints. Alright, raises, let me see this foot. Feeling the toes. No crepitus in the joints. Let me see this stuff. Feeling her toes, no crepitus in her joints. Alright, so no crepitus. On palpation, no crepitus, no tenderness, no swelling, no deformities felt anywhere. Alright. Trying to make you do everything standing up while we standing up. Alright. So I think that we can sit now.
I'm gonna sit in the chair.
You can sit right here. Alright. So another thing noted with palpitation with the wrist. Hold your arm out. Let me know if this hurts. Not hurting. So palpating the wrist gives a negative tenal sign. So no sign of carpal tunnel. Alright. So now I already tested her shoulders, her head, and her neck. They all have full range of motion, good strength, +5 to gravity and resistance. So now I'm going to test your arms. So can you raise your arms up for me like this? Okay, I'm going to press down. Don't let me press down. Okay, press down on my hands. Okay, good. Now put your arms down. Can you put your hands on your head? Can you raise them in the air? Can you put them behind your back like this? Can you cross them on your back like this? Okay? Alright, you can put your hands back down. Alright, so good range of motion, +5 against gravity and resistance in her arms. I'm going to test her elbows. So can you bend your arms like this? Alright, I'm going to pull. Don't let me pull you. Good. Okay, can you press against my hand? Good job. Alright, put your arms back down. So full range of motion, +5. Noted in the elbows, the shoulders, the head, the neck, the arms. Alright, so now with your hands. Okay. Can you put your hands up like this? Can you spread your fingers out? Can you put your hands back down? Can you put your hands like this? So there's a negative balance test. Alright, so you can put your hands back up. Alright, press against my hands. Alright, I'm going to press back against. Okay, good. So good strength noted in the hands and the wrists. +5, full range of motion to gravity and resistance. Alright, can you make a fist? Alright, now I want you to touch each finger with your thumb like this. There you go. Okay. So full range of motion noted in the fingers as well. You can put your fingers down. Alright. So now I think I'm going to have you lay down. I had to readjust the camera. Alright. So can you point your toes for me? Can you flex your toes back? Alright, press against resistance. Flex your toes back. Okay, now push down like a gas pedal. Okay, good. Alright, can you raise your right leg? Alright, so push down. Alright, keep your leg right here. I'm going to press down and let me push down. Alright, put this leg down. Can you raise this leg? Alright, I'm going to push down, don't let me. Good job. Alright, push down on my hand. Alright, you can put that leg down. So now I'm going to bend this knee. Alright. Now I'm going to rotate it in. Rotate it in. Stop being so still. Rotate your leg in. Alright, rotate it out. Alright, so now I'm going to raise your leg up. Alright, so bend your knee back. Alright, so press up against my hand with your leg. Okay. Now press back. Good. Put your leg down. Alright. So now I'm going to bend this knee. Alright, we're going to rotate your leg in. Rotate it out. Okay, press back. Alright, press down. Good. Now we're going to lift this leg up. Keeping the knee straight. So I'm doing the straight leg test. There's no pain. Do you feel any pain?
No.
Okay. Any pain?
No.
So negative straight. The straight leg test reveals no pain. Alright. So our range of motion is a +5 against gravity and resistance. No pain was inflicted with the straight leg test. Negative balance test. Negative tenal sign. Alright, you can sit up for me. Alright. So this concludes my assessment.